I am Dr. Cohen. If you clicked on this icon, you would have been interested in Westernization surgery. As a plastic surgery fellow, I trained in New York with a very well-known Korean plastic surgeon who taught me and trained me in the techniques that are very specific to people of Asian descent, specifically nose augmentation for people who have very low dorsal profiles, and double eyelid procedures in those people who are born with no upper eyelid crease, as many people of Asian descent are. Nose augmentation is a common procedure, and I've been through the gamut of techniques to augment the nose. I've used silicone, I've used rib grafts, I've used Gore-Tex, I've used skull bone. Really, everything that's been out there I've tried, and I've settled on MedPore, which is a synthetic nasal bone implant, which comes pre-formed. I think it's an elegant material, which is far better than anything I've seen and gives you very natural results. Unfortunately, this does require an open incision over here at your columella to insert the implant, but unlike silicone, becomes part of your body. Unlike Gore-Tex, is firm as appropriately so for the nose. And unlike your own cartilage or your own bone, it doesn't warp and it doesn't get reabsorbed. So it has all the advantages of bone and appropriate hardness, and none of the disadvantages of your own tissue. And because it's porous, your body grows tissue into it, unlike silicone, and the infection rate is about the same or even less than your own tissues. So that's the material that I use for nose augmentation, and it's elegant, it's lovely, and I've done hundreds of them successfully. Interestingly, approximately 20% of my nose augmentation practice is redoing other doctors' work. Not because they're bad doctors, but because the silicone that's commonly used is often fraught with problems, from infection to extrusion and appearance of translucency or seeing light through your nose, just in very unnatural outcomes. People who go from silicone implants in their nose to MedPore are thrilled, and the results are extremely natural. So I would encourage you to come in and talk to me about it, to feel the implants, to see my pictures, and to really learn more. For those of you who have only a single upper eyelid, or doing a double eyelid procedure is very common, people of Western descent and some Asian patients are born with a natural upper eyelid crease. That's simply the muscle fibers that come from your upper eyelid levators, which are the muscles which open your eye, coming out to insert onto the skin. For those patients of Asian descent, there's simply no muscle fiber attachments to the skin. All we're doing in those cases are creating an attachment from the skin down to the muscle. It's very easy to do, and the question that I get asked all the time is, how do I make you look like someone of Asian descent and not like someone from a Western culture? Well, if you look at people from Western cultures, typically if you measure the distance from their upper eyelash line to the crease of their upper lid, it measures anywhere from 8 to 12 millimeters. Those people of Asian descent who do have an upper eyelid crease, that's usually only 4 to 6 millimeters. So placing the crease at the right place for people of Asian descent allows them to keep their ethnicity. That's something I pride myself on understanding, and the cultural aspects of those changes are something that's important to know. And it's important that your doctor has an understanding of that and understanding the cultural changes that are going to occur. This is a very easy procedure to do. The risks are really recurrence or relapse, if you will, and are typically easy to fix up if that occurs. Mild asymmetries are also possible, but the recovery from these procedures are very swift from the upper lids and the nose, and I have a very strong background in performing all of them. There are some patients who have very wide jaws who are looking to reduce them. This can be done, but I typically am going to refer you out to somebody who is an oral surgeon to take care of those problems. Those procedures tend to be bigger, and they tend to be fraught with a little bit more complication in the jaw reductions, and I prefer to send people to oral surgeons to get those things accomplished. They can be done in concert with me at the same time, and I'm happy to refer you to people who have significant expertise in that arena. I look forward to meeting you, and please feel free to contact me for my books if you wish to proceed, and to talk to any number of Asian patients, people who have gone through any of these procedures, to get some idea of what this is all about.